Oh, hello. I didn't see you there. I'm Scott Fox, lifelong insurance nerd. And today, we're tackling Medicare enrollment. Because trust me, you don't want to mess this up. If you're about to turn 65, you might be wondering, when do I enroll in Medicare? Do I really need Part B? And what happens if I miss the deadline? You're not alone. Over 10,000 people turn 65 every day in the United States and face the same questions. So today, I'm going to break it all down for you in simple terms. And stick around till the end. I've got a pro tip that can save you hundreds of dollars in annual Medicare penalties. First things first, let's talk about when to enroll. Medicare gives you a 7-month window to sign up. That's 3 months before your 65th birthday, the month you turn 65, and 3 months after. Now here's the key takeaway. If you sign up before your birthday month, your coverage starts on the first day of your birth month. But if you wait until the month of your birthday or later, there could be a delay in your coverage. And trust me, you don't want that. Medicare has multiple parts, and it can feel a bit like alphabet soup. Let me break it down for you. Part A is hospital insurance. This is usually free. Part B is your medical insurance. There is a monthly premium for Part B. Part C is Medicare Advantage. This bundles A and B together, and sometimes D. Now, Part D is your prescription drug coverage. This helps with medication costs. Most people start with Original Medicare, which is Part A and Part B. But if you want extra benefits like vision, dental, or prescription coverage, you may need Part C. Choosing the right plan is crucial, so don't rush this decision. Now that you know when and what to enroll in, let's talk about how to enroll. The fastest way is online through the Social Security Administration's website. You can also enroll by phone or visit a Social Security office. But honestly, I recommend the online method. It's quick and easy, and you can do it from your couch. Here's where people make expensive mistakes. If you don't enroll in Medicare on time, you could face lifetime penalties, penalties that last forever. Let's break it down. The Part B late penalty. Your monthly premium increases by 10% for every 12-month period you delay in signing up without other qualifying coverage. The Part D late penalty, you'll pay an extra fee for every month you go without drug coverage. These penalties never go away. They last forever. So the best way to avoid them is to enroll on time or make sure your employer insurance is considered creditable. Nowadays, a lot of people keep working past 65, so they wonder, do I still need Medicare Part B? The answer is maybe. If your employer has 20 or more employees, you can delay Part B without a penalty. But if your company is smaller, you must enroll in Medicare on time. Now, if you delay signing up for Part B because you have creditable coverage from your employer, you will get an 8-month special enrollment period when you retire to sign up without any penalties. But if you miss that deadline, guess what? More penalties. Now for the money-saving pro tip I promised. If you qualify for extra help or a Medicare savings program, you may be able to reduce or even eliminate Part B and Part D penalties. These programs are income-based, but many people qualify and don't even know it. So before you panic about penalties, check to see if you qualify. I'll drop a link in the description to help you find out. You're now ready to enroll in Medicare the right way. If this video helped you, do me a favor. Please like and subscribe and hit that notification button so you don't miss any of my future Medicare guides. And before you go, let me know in the comments, what part of Medicare enrollment confused you the most? I answer every question, and I'd love to hear from you. And I'd love to help. So don't forget to subscribe. Thanks for watching, and here's to a smooth Medicare journey.